Sleep is not one of the pillars, it's the bedrock. It's not normal to feel like you're dragging every single day. Even women who sometimes have sleep apnea that go undiagnosed because they're younger, they're thinner, they don't fit the typical bill.
So many go for much too long,
Yes.
struggling with sleep, not even just for weeks, it can be months
Oh my
or
gosh.
years. Welcome to In Bed With. I'm Dr. Cheri Mah, and today I'm joined by Dr. Shelby Harris. Welcome.
Thank you so much for having me. I'm really
Excited to be here.
Same. I'm really looking forward to talking with you.
Well, I want to start with one question is, how did you sleep last night?
I slept okay, but because I'm on the West Coast talking with you and I came in from the East Coast, I woke up about 2 hours earlier, and then it was lighter sleep, but that's to be expected. But otherwise, I passed out right when I got here.
Awesome. I know it's hard with the jet lag, definitely. Do you do anything when you're coming westward to try and help with that shift at all?
I usually make plans in the evening to try and stay awake with like going out for dinner and things like that, just to try and stay awake as late as I can to help. And if you can, like trying to not adjust, like if I'm going right back home, I might not do that much to really to adjust because it'll make it harder when I get back home.
Definitely. Short trips make it easier just to stay on your local time.
Exactly.
Some folks may not know what behavioral sleep medicine is. Can you share a little bit of light on that?
So behavioral sleep medicine is kind of this subspecialty within the field of sleep medicines. It's the treatment of sleep disorders using evidence-based practices without the use of medication. So in really wonderful sleep centers, and I know you're at one yourself, like we often will work in a very multidisciplinary team. So you have sleep medicine physicians, you have behavioral sleep medicine doctors, you have ENTs. We have all different people who are coming at looking at sleep disorders from different perspectives. And that's really where I work mostly. So I work with patients who have insomnia, sleep apnea, issues with using their machine. We'll work with patients who have narcolepsy, circadian rhythm disorders, night owls. So I do a lot of work with patients in a very broad way, and from kids to older adults, which is what I love the most about my job, is there's a huge range of ages that I work with.
Right, because sleep affects all of us, which is, I think, what is, an interesting component of this particular area is that it changes when we're little as children, and then it evolves into teens and as adults, and you see different challenges along the way.
Yeah.
So you get to see that whole spectrum of it.
I see it, and it will never be lost on me that when someone is sleeping better, or they have a family member who's sleeping better, or a kid, or whatever, you can see it on their face when they come in. Like, I just know, and that foundation of sleep that they've now found again, how it impacts so much more of their lives. I just love it. And we know that everything from top down, it can impact, right? So cognition, mood, quality of life, cardiovascular function, GI issues, reproductive issues. We just know balance, higher rates of accidents, absenteeism at work.
Yes, I mean, I think what is so critical about sleep is it affects every aspect of our functioning, from, as you mentioned, the cognitive domain, making better decisions, our judgment, our ability to have emotional regulation, to then the physiology of how our body works, right? From our hormonal regulation, our temperature control, being able to stay healthy and not get sick, to not getting injured. For some of my athletes, that's the
all these
important
things,
part.
right?
And
recovering from injury, right? It's just so important. And I think the other thing too is that if you're working on other issues that you have, whether it's a medical issue, a psychiatric issue, depression, anxiety, in my area of specialty, if you're not working on the sleep as a really key component of what might be factoring in, then you're missing out on really having a really appropriate, effective treatment overall.
Yeah, and it's something that doesn't affect just your today, right?
Yes.
We recognize from a number of studies and the current literature how it can affect health long term. So there's just so many places that sleep touches that I'm thrilled that it's become part of the more common conversation, but I think we still have a far ways to go with this.
Agreed. I think it's been an interesting shift in the field, and you've, I'm sure, seen this as well, that when we started out, everything was talking about sleep disorders. There wasn't really much talk in the general public about sleep health overall. And then it's shifted a lot to, yes, we're still talking about sleep disorders, but we're talking about how sleep can help bolster your life overall.
Definitely, because it's now a little bit more recognized. It's not just exercise and nutrition, right? There's this pillar of sleep health that we know is so critical for your day-to-day functioning, but then when you look at lifespan, health span,
Yeah.
that it has to be an important foundation as well. Huh?
And I say all the time, to your point of foundation, I say, we always talk about these pillars of health. I always say that sleep is not one of the pillars, it's the bedrock.
I'm with you right
Yeah,
there.
it's like-
I give it extra weight
Right, it's
above.
like if you're putting pillars in something that's not sturdy and not steady, those things are not going to stay very well. So we need to have a good solid foundation of sleep to help diet, help exercise, help cognitive functioning, all the other things that we want to live a full life. Sleep is the thing that's going to help bolster all those other things.
Definitely. I feel like you touched on an interesting point about how some people are willing now to engage with providers to not necessarily look at sleep problems, but trying to look at how to optimize this area for themselves.
I think when we're talking about people who are hesitant to engage with providers, I think there's also the idea of like, well, what do they think they're going to get from the provider? So there's a lot of misunderstanding or misinformation of, well, if I talk with my provider about sleep, they're automatically going to put me in a sleep lab and make me sleep overnight and hook me up to all this stuff. Or that automatically means that I'm going to be put on medication, or that there's a lot of, I think, preconceived notions of what the treatments are when we have so many different things at our disposal. And then the other big thing is people don't always want to work on it because it takes time, it takes effort, it takes appointment times to go and talk with someone. I always encourage people to think about their sleep in 3 different domains, and where their problem might be. So is it that you can't sleep enough no matter how much you're trying? So if you're trying an 8-hour window and you're only sleeping 5 hours, is that a problem for you? Quantity. Is there a quality issue, which I think is the bigger issue that doesn't get spoken about? So like I might sleep or feel like my sleep's really broken, but it just doesn't feel like it's restorative. Or do you feel like you're skimming your sleep throughout the night? So that's the other big thing. And then the final category is the timing of your sleep. So are you just not sleeping on the clock that you would ideally like to sleep? So if you can come in with those categories thought about, then you'll be better off.
I love that. That's how I also categorize, the duration, the quality, and the timing.
And to that point, you don't have to use all the fancy trackers. You don't have to get one at that point, but you can get National Sleep Foundation. You can go online and get a sleep diary. My website has one. You can get whatever sleep diary you want and just start tracking it on paper and pencil so that when you go to your physician, you can say, look, this is what's going on.
Yes.
And then I love it when people do that, because then when they end up in my office, I've already got a few weeks of sleep diary data and we can hit the ground running.
I agree. Yeah, pen and paper is perfect as a starting point. I
Exactly.
always recommend at least capture 2 weeks, and not
Same.
like a month, so that we actually have more trends to be able to view from weekdays to weekends, and be able to have more of a understanding of their typical habits over time.
sure.
And if you use a wearable like many people do nowadays, all helpful
great.
too,
Yeah.
and that can just be another tool in that conversation. Well, tell me more about your work with women and sleep.
Yeah, so for 20 plus years now, I've been working mostly in the insomnia space, but I do treat narcolepsy, sleep apnea, like all these different areas. But really within the insomnia space, so many of my patients over the past few decades have been women. This was before we were talking about menopause in the mainstream like we are now, since the pandemic really started to happen. And it's just a passionate area that I have, because so many women for so many years were told this is kind of what happens as you get older. And even before we would talk about MHT, menopause hormone therapy, before that became kind of more acceptable to be used as a treatment for a lot of people, people were like, it's either meds or nothing. And we have a lot of things that we can use to help women that it's really like, just to suffer for the sake of suffering is just unacceptable in my book. So we have, like, for example, cognitive behavior therapy for insomnia. We have ACT therapy for insomnia. We have medications. We also have menopause hormone therapy that people are being prescribed more. There's not one size fits all. Even women who sometimes have sleep apnea that go undiagnosed because they're younger, they're thinner, it's just they don't fit the typical bill of what you would think sleep apnea is. We were talking about it being rewarding when someone gets a good night's sleep. That, to me, when I see a mom, a woman who's in their 40s, 50s, who's just been suffering for 10, 20, 30 years, now start to understand what good sleep looks like, it's a game changer.
Definitely. And I think you hit a point too about how women can present differently
Yes.
than men in their sleep concerns, their sleep disorders, or even some of the questions that I see as well. Because, women who have sleep apnea, it's not always the typical snoring
Yeah.
or being really overweight as initial symptoms that may trigger a conversation with a provider, right? It could be the fatigue or
Exactly.
unrefreshing sleep, or it could be the insomnia that actually triggers that pathway to evaluate if is sleep apnea.
Yeah. And then there's the stigma too, right?
Right.
So there's the idea of if I bring up a sleep issue where I'm really tired to my doctor and I just don't feel like my sleep's unrefreshing, a lot of women are afraid that they're going to automatically be told, well, it's because you're in perimenopause or menopause or because you have depression. And maybe that could be true for some of it, but a lot of times it's not. And I see it's interesting in my practice, people come to me a lot for insomnia.
Right.
So they're coming to me for insomnia, and then after just talking with them in a full intake, it becomes very clear to me that they need to be evaluated for their sleep apnea as well, because we see COMISA,
Right.
comorbid, co-occurring insomnia and sleep apnea. So we see them hand in hand all the time, but the sleep apnea part is just totally missed, and I'm the one who has to actually say, well, let's get you evaluated for that as well. And we have a lot of work to do when it comes to education in the
Yes.
field. Like the fact that we're talking about this now is so big, and there's so much just misinformation, and just physicians don't know necessarily. They're not always thinking sleep apnea as a potential thing. It's insomnia is the thing that gets talked about more than anything else.
I know that the Resmed Global Survey specifically asked women about their struggles with getting quality sleep, as
Yeah.
you've discussed. And I believe that there's 44% that in women who are in menopause say that they struggle with sleep, 3 days out of the week, versus those that are not in menopause, I believe is around 33%. So
Yeah.
there is this larger group of women who really have difficulties getting the rest that they need
Yeah.
every week.
Yeah, I'm not surprised. It's sad, but I'm not surprised. It's almost like a perfect storm of three different areas. So we see hormonal issues that are going on when we see sharp drops in estrogen, progesterone. That's really what's fueling a lot of it. Then we also see higher rates of anxiety and depression in women. And then we also see more social stressors. So women in midlife are having kids later than they did before. They're also in the sandwich generation. I know I'm there, right? I have kids, and then my parents are aging, and then work, right? Work is just, women are working more than ever before, and things are 24/7, right? With phones and everything. There's just no time to turn off. So we need to address those three areas to really get at the root of what's going on.
Yeah.
But yeah, I think just being better at assessing and just knowing that it's not normal to feel like you're dragging every single day. And if you think something's off, you need to bring it up.
Are there certain time points in this progression, whether it is perimenopause, menopause, postmenopause, that you really think women should stop and take a second to evaluate how their sleep is, or come talk to a provider when they have the beginnings of maybe some concerns?
Yeah, when it comes to insomnia, for example, I like the idea of 3 or more nights a week where it's problematic. I think also the problem in our society too is that when we've gone from this shift of like sleep disorder talk to
Sure.
sleep health, it's almost been like we're expecting perfection every day. I don't sleep perfectly every
Right,
single
yeah,
night, right?
no, neither do
that's-
I.
Right. So I think if you start noticing that you're not feeling refreshed, your timing is off, the quantity is off, there's something just not like it had been, and it's happening I would say 3 or more nights a week, and it's going on for a few weeks, that's when I would definitely bring something up. I don't think the time point in your life really matters,
Yeah.
because there can be a million reasons why you might develop sleep problems, but hormonal changes, pregnancy, adolescence even,
Yeah.
postpartum, we see it at different times. But whenever you start to notice something's off, you should say something.
Yeah, no, I agree. I think so many, not just women, but
Yeah.
a lot of individuals go for much too long,
Yes.
struggling with sleep, not even just for weeks, it can be months or
gosh.
years.
Yeah.
Like, why did you wait for a decade to
that's-
come address some of these questions and concerns?
That's the big change I've noticed too in the field, with more talk about sleep health in a good way, right? For ages, I saw people who would come to me with insomnia that had insomnia for 20, 30 years. That was not an uncommon story. Now it's 4 or 5 months, which is like a game changer.
Yeah, no, I think that that's definitely helped
Yeah.
get people to be more aware of their habits and then be able to seek help faster.
Exactly.
So, Dr. Harris, you may know that my research is specifically in sleep and sports, and so I have a heart for athletes, but I heard you run yourself. Can you tell me about some of your running history and how you got into it?
Yes. Also, I love your research and have followed it for a long time. So big fan in that area, especially.
Thank you.
So when it comes to running, I was allergic to running. And then when I got to Montefiore and I was working in the sleep lab there, and this was like early days when I was first starting to work there, early 2000s. There was research coming out that was looking at whether patients would take the advice of a clinician if they didn't think the doctor was following that advice themselves, especially when it came to like exercise. And I was so horribly out of shape that I started to think like a little differently about what I wanted to practice what I preached a bit more in that area, because we were talking with people about just movement, not running marathons or anything like that, but movement, diet, all these things to help with sleep, sleep apnea, many different areas. And so I joined a group called Team in Training, which was through the Leukemia and Lymphoma Society. And I started one day just run walk. I'd run for 1 minute, walk for 4 minutes. And then I started doing that. And 10 months later, they trained me to run a full marathon. And
amazing.
it's amazing. And most people were, myself included, in total shock that I did it. So I did it, and then I realized, like, I actually can do this. And I got the bug, and I really loved getting a medal at the end, too. I'm a sucker for a medal. All my friends know this. So I just really got into it. And now I've run 26 marathons. Sometimes I do.
That's impressive.
I still can't believe it. It's something to me that gives me so much consistency in my life. And I also run with a run club. And for me, it has made a huge difference in just socializing with people on the weekends, getting out of bed. I mean, I have kids that know that this is like what mommy does on a Saturday morning. Like, that's what I do. And it's just that modeling of behavior to others too is really wonderful. Like, my kids want to exercise, and it's not like I'm talking about it constantly. They just see me doing it.
All right, Dr. Harris, we're going to switch gears a bit and talk about some of the common sleep trends that are popular right now.
For trends, I think trends that aren't great. It's just the idea of all these supplements that are out there, and people are like mixing them together, and like Sleepy Girl mocktails, another really big one that people are doing. That, yeah, we have little bits of data for some of the things, but it's not really anything that's like a real evidence base.
Right.
So
Can you explain what the Sleepy Girl mocktail is?
Thank you, yes. So it's combining, magnesium powder with, what else is in it? There's
Usually tart cherry
juice, and then there's like a fizzy, like a seltzer, right? So they're combining these things that people talk about as hacks for sleep. And yes, we have little bits, but if you're using this to try and treat a sleep issue that's happening more often than not a few nights a week, you probably need to see an actual professional as opposed to drinking a Sleepy Girl mocktail.
I would agree. Can you share one of your favorite sleep myths and please help debunk one of those myths for us today?
I have two.
Okay.
Can I give you two?
Yes.
So one is that 8 hours that we hear all the time, that you have to get 8 hours of sleep or else XYZ is going to happen. So for most people, it's generally between 7 to 9 hours. That's where the 8 comes from. It's just in the middle, it's easier to report. But some people need a little on the lower end. Some people need a little bit more. So to focus on just treating a specific number without thinking about how do you feel throughout the day, I think it's doing a disservice to a lot of people. Because if you're a 7-hour night or even just under 7, but you feel well rested, you don't feel like your sleep's a problem, you've been like that for a long time, then you might just be on that lower end, and it doesn't mean that it's something that you need to necessarily treat. And then the other thing is that more is better, people think too. So 9 hours, 10 hours, I'll get more sleep. That's not necessarily better either, right? So you might
Can lead to insomnia, right?
Exactly. It can lead to insomnia, but you also might have an issue that's causing you to have too much sleep. So you might have sleep apnea. You might have some sort of an excessive sleepiness issue. Certain medications might cause you to sleep more. So there isn't a magic number. We just know ranges that work for most people.
All right, what's the second myth that you want to bust today?
That we need less sleep as we get older. So I see that one, especially because I work with women in the perimenopause, menopause age, and older adults all the time. They're told, oh, you don't need as much sleep as you get older. It's totally normal. The sleep gets lighter and somewhat more broken the older you get. And sometimes older adults will be napping more. So in a 24-hour period, it's about the same amount of sleep.
Well, definitely, because really, when we're talking about the lighter sleep, your sleep architecture is changing, right?
Exactly.
So when we have light sleep, deep sleep, and then the rapid eye movement dreaming sleep, those proportions obviously change through the lifespan. And I think a lot of folks get they misperceive that when they're having those awakenings during the night, that they don't need as much,
Yes.
right? Which is not
Exactly.
true.
And I think there's also the idea too, another myth added in, that you should be asleep and like kind of knocked out throughout the night without waking up.
I think that's the expectation that a lot of people have, that
Yeah.
you should fall asleep at the beginning of the night and then never wake up through the whole night. And I actually think normalizing that and realizing that awakenings are very normal in your sleep architecture can be reassuring to a lot of individuals. And they say, okay, if I'm not waking up for more than, let's say a half hour in total throughout the night, then that's not that concerning. Going for
Exactly.
5 or 10 minutes and then rolling over and falling back to sleep is actually okay.
Yeah.
I love it. I want to ask you a bit more about travel. Are there other recommendations that you have for your patients around travel and how to best optimize their trips?
Yeah, I think if you it also depends too on like how far are you traveling, the amount of jet lag that could happen, time zone changes. I think adjusting as best you can a little bit in advance is very helpful. But then just like thinking about on the plane, once you get there, all the things of whether it's light exposure, darkening the room, the white noise machines, all that I think is important. So once you're there or on the plane is really helpful to try and just kind of get a quiet cocoon-like state as best you can. And then also if you're really concerned about a bigger trip that will have some jet lag, there are great apps out there and ways to help teach people how to change their kind of schedule in advance, and once they get there, and when to get dark, when to get light, avoiding alcohol, when to use caffeine strategically, when to take naps. All those things can be built in to really help with minimizing jet lag. So I think if for the bigger trips for me, I do think about using all those kind of strategies more.
There's a lot to think about here. You listed, 10 different factors, which can feel overwhelming for a lot of people traveling. I get it. And even for myself who understands the science, you're trying to think about this schedule. So to your point, trying to do things even in advance of when you get on that flight. Now, directionality we know matters, right? So going eastward, there's different recommendations. And if you're flying westward, and the general rule of thumb, right, every time zone you cross, it takes approximately 1 day to acclimate. But there are things you can do in that lead up a day or two before getting on that flight to try and shift that schedule a bit. Even by a half hour would be helpful.
Yeah. And most people are really surprised by that number of time zones crossed, number of days. Like when from New York to Europe, where a lot of people will travel, where I am, like there's a 6-hour time zone change a lot of times. I'm like, by the time you're coming home, that's when your body would actually fully be adjusted. So what are things that we could do to help get you a little bit better acclimated in advance? And alcohol is a really big one. Stop. Hydrate. Try to stay away from the alcohol, and also try to like get on the time zone or the time schedule with your eating, your kind of that kind of routine can help a lot too.
Yes, and then in particular the sleep schedule. That's one I always recognize that falls short. A lot of people will get on planes, and then that's time that they view to relax, to binge watch their favorite show, to catch up on the things that they need to, which I very much understand and recognize. But the attention to when you should take a nap or when you should be sleeping on that flight, I think is a newer concept for folks that you want to try and shift as soon as you get onto the plane so that you're better onto that sleep schedule when you arrive.
So little things like that can make a big difference too, to protect sleep.
Definitely. So Dr. Harris, I think some people are at very different places in their sleep journey. Why should we really care about our sleep health?
Yeah, it's such an interesting question that we get in our field of like, why is sleep important? And I always just think about it as the thing that keeps everything just working as it should be in our bodies. What we know a lot about is what happens when we don't get enough sleep. Poor quality, poor quantity sleep. We just know it really impacts so many areas of our lives that just trying to work on sleep keeps your body and your brain working as it needs to be long term.